These kids aren't typically vaping like a smoking cessation person would. Your doctor would typically tell you, if you're a pack-a-day smoker, to start with like a 20 level nicotine in your vape juice and wean your way down from there. These kids are starting at about a 50 level and they're not weaning their way down. And they're half our body mass. I mean, they are getting really buzzed and high. It's not anything we want our kids to be doing. And speaking to them about it when they're young, just so they know, and a matter-of-fact conversation, not a you're not trying this or we forbid this or anything like that, right? Because then that's the first thing they're going to want to do. But just being really open and asking them open-ended questions is a really good way to do it. So sitting down with your kids and saying, hey, have you ever heard of a vape pen? Have you ever seen a vape pen? Or, sometimes we are in town and we see this big puff of smoke, by somebody. What do you think of that? What do you think that is, right? So you've got to talk to them in an age-appropriate way, of course. That would be for someone younger. But have the conversations around it and maybe let them know that, hey, you know what? We have tried, we've looked into this and there's some science now, and this stuff's actually pretty bad. The follow-up to that, seriously, is don't trust what they say. And I hate to say that. I'm not one of those helicopter moms that was always hovering over my kid, but they hide the stuff, right? I mean, just like we might have. You've got to look and you've got to learn. You've got to learn what that stuff smells like, and you've got to look, search their rooms. Be on their Facebook and their Instagram if they have any of that stuff, right? The Snapchat's hard because you can't follow all the stuff, but it's important to watch that stuff as well. And when you can do some of that, you can also sometimes link and see what some of their friends are doing. That can tell you a lot too. So if your kid says he's out with so-and-so, or that they hang out together a lot, and then you happen to see some stuff on that kid's page, that can give you some indicators that, okay, maybe my kid is doing this and you need to look a little closer.
Hi, my name is Lee Mordyke, and I'm the Prevention and Advocacy Program Manager for Arbor Circle. We know that as a parent, it's hard to have those tough conversations around drugs, alcohol, mental health, and vaping has been a growing concern for our teens, and for parents, it's been really tough to keep up. So if you need help talking to your teen or preteen about vaping, you can find resources and talking points at arborcircle.org/OSAP. We would also encourage you to talk to your child's physician. If you need even more support, you can always reach the Arbor Circle and the OSAP team at 616-396-2301.